Hello besties. So today we will be discussing about adhesive capsulitis, which is a shoulder pathology. So basically adhesive capsulitis is a condition which is characterized by the stiffness and pain in the shoulder joint. Basically this condition occurs in people with diabetes who have a history of diabetes, and what happens is in adhesive capsulitis is there is an insidious and progressive loss of active and passive mobility in the glenohumeral joint due to capsular contracture. Obviously, as the name suggests, adhesive capsulitis, which means that there will be adhesions in the capsule of shoulder joint. Okay, so there will be shoulder joint capsular contracture, due to which there will be loss in the movement of shoulder range of motion. Most commonly, it affects women from 40 to 60 years of age and 2 to 5% of the population, increasing to 10 to 38% in patients with diabetes and thyroid disease. So it is seen that diabetes and thyroid disease patients have adhesive capsulitis more commonly. So significantly higher incidence in people with diabetes mellitus. The people who have diabetes mellitus are at a risk of getting adhesive capsulitis much more than other population. So we are clear with the term adhesive capsulitis, I guess. As the name itself suggests, adhesive capsulitis, which means that there will be adhesions and scar tissue formation in the capsule of the shoulder joint, due to which what happens is there will be loss in the range of motion. Both active and passive range of motion are affected in shoulder. So the loss will be according to the capsular pattern. So we have to check for the capsular pattern for the diagnosis of adhesive capsulitis. Capsular pattern seen in adhesive capsulitis will be the loss of external rotation of the shoulder will be largest, okay, and then external rotation, then abduction will be affected, and then internal rotation will be affected. All right, so in this pattern the affected movements will be seen. We have to check for the shoulder capsular pattern. All right, the symptoms of adhesive capsulitis will be pain in shoulder. There will be shoulder pain, obviously, which is, which will be there. Shoulder pain will be there, and then pain gets worse at night. Mostly the patients, they in the later stages they find it difficult to sleep. Sleep disturbances will be there due to pain in the shoulder, and then there will be stiffness on movement, obviously, as the capsule of the shoulder joint is affected. So there is gonna be stiffness on movement. The movement is not easy, it is stiff. All right, all the activities will be difficult, like reaching upwards, taking something from the upward, or combing hair, doing external rotation activities like while bathing, scrubbing the back and everything. So these movements will be affected. The patient will mostly complain of pain in the shoulder, and the pain will be it will be radiating towards the shoulder and laterally towards the shoulder. All right, right. Fine. So after that there will be capsular pattern affected. As I have said, that the movements will be the movements affected will be in the capsular pattern. Capsular pattern में movement effect होएंगी. Then unilateral shoulder pain, mainly non dominant side. So there, this disease or this pathology is not a bilateral pathology, it's a unilateral shoulder pathology. So there will be pain in only one shoulder, one side of the shoulder. And mostly it is affecting the non-dominant side. Like if the person is, the hand dominance of the patient, if it is right hand dominance, so shoulder pathology will be seen mostly in the left side of the shoulder. All right. And then in diabetes mellitus patients, it is commonly seen on the dominant side. So it is the feature that diabetes mellitus patients have adhesive capsulitis, commonly seen on the dominant side. Pain radiates up to the deltoid insertion. Pain will be radiating laterally on the shoulder. The patient will complain of lateral side pain, and it will be up to the deltoid shoulder, deltoid insertion. Sorry. Loss of movement markedly, एक्सटर्नल रोटेशन सबसे ज़्यादा, द मोस्ट commonly affected movement will be external rotation. So the patient will be complaining of not being able to scrub the back while bathing, right? So in all those cases, external rotation will be affected more. Then the clinical presentation of adhesive capsulitis. We have seen adhesive capsulitis. We can see it into 4 stages. So it is a disease, or we cannot call it a disease. It's basically a pathology which progresses through 4 stages. So every patient with adhesive will undergo 4 stages. So there are 4 stages which the disease has to undergo. So now we will be doing the presentation of those stage. How will you know that the patient is in which stage of adhesive? So in stage one is also known as pre-adhesive stage. It lasts up to 3 month duration. So pre-adhesive stage will be from 0 to 3 months, right? 0 to 3 months. It is the in acute cases. So the patient will be in stage 1. There will be sharp pain in the shoulder, and there is gonna be sleep disturbances in this stage. It can be present like impingement. The patient may complain of impingement like symptoms. And the hallmark of this stage will be the loss of external rotation. The patient won't be able to do external rotation, both actively and passively, but under anesthesia there will be full range of motion. Okay. Stage 2 is also known as freezing stage, which lasts up to 3 to 10 months. And in this stage there will be loss of active range of motion. Active range of motion will be lost in this stage completely. Some loss of range of motion under anesthesia. In stage 1, what was happening was, under anesthesia the patient is able to perform the range of motion, all right, but there is gonna be some loss of range of motion under anesthesia as well in stage 2. Stage 3 is also known as the frozen stage, which lasts up to 9 to 15 months, or we can say 10 to 15 months this stage lasts. All right. Then in this stage what happens is the pain it subsides. Pain starts to subside. So there will be reduction in pain, significant loss in active and passive range of motion. Both the active and passive range of motion will be lost, all right, in this stage. In stage 2, what was happening was only active range of motion will be affected, was affected. But in this stage, both active and passive, both the range of motions are affected. Stage 4 is also known as the thawing stage. So it is the last stage of adhesive, which lasts up to which is from 15 months 15 months to 24 months. So by this, we understand one thing, that adhesive, it progresses through 4 stages, and it is a disease which is self-limiting. So after 2 years, it persists for 2 years, almost 24 months, which is 2 years. So this disease, after 2 years, it subsides on its own. But 2 year of shoulder pain and loss of motion is a great deal for someone. All right. So the treatment of this disease is also very important. In stage 4, what happens is, there will be stiffness for 15 to 24 months. So stage 4 is going to be from 15 to 24 months, and there is resolution of pain. The patient does not complain much of pain, so there won't be any you know pain which disturbs the night sleep of the patient. But there is going to be continued loss of active and passive range of motion. Both the active and passive range of motion will be limited in the shoulder till stage 4. So for 2 years, this pathology persists in a patient. What is the treatment of adhesive? So in the treatment, we can give anti-inflammatory medications, because there is going to be inflammation of the capsule of shoulder joint. So we can give anti-inflammatories, we can give corticosteroid injections, we can do joint distension. Physical therapy is the solution, if I tell you. Because in physical therapy, what happens is, the capsule is stretched, the joint range of motion are rehabilitated, and the patients gets well. Physical therapy has shown great this progress in the cases of adhesive. And then we can also go for arthroscopy. Arthroscopy is done by this instrument, which is also known as arthroscope, and by this a surgery is done, and the adhesions and the capsular fibers, fibrosis and all is removed. So thank you. This is all for the lecture. If you like the video, please subscribe to my channel, like the video, and comment down your suggestions if you want me to improve on anything. Thank you so much.